It depends what a patient wants. The traditional or the older, I should say, not traditional approach was that you have a new diagnosis of advanced cancer, you have treatment with your oncologist till this time, and then you see palliative care right at the end. And I think this approach is wrong. And I think what you should happen is you should see your oncologist, and when patients are ready, they should see palliative care, and it might even be sooner. Some patients have a lot of symptoms, some patients have no symptoms, some do not want to see anybody other than oncologist. I think we all work as a team, and the model at Mater Cancer Center is fabulous in that regard, that we have palliative care and oncology, both for public and private patients working together. In old days, the role of palliative care was to provide end-of-life care, but palliative care is not end-of-life care. Palliative care is actually supportive care, and I believe if there is an earlier relationship, it helps. But I think it doesn't apply to all patients either. I see somebody for the first time, they've got advanced breast cancer, they are in shock. Sometimes you mention the word palliative care to them, they would think this is a hopeless oncologist, he thinks I'm dying in the next 2 weeks, I don't need to see palliative care, I'm going to get a second opinion. But if I have treated a patient with breast cancer or any cancer for that matter, and I think they may have less than 6 or 12 months to live, and they may be on, say, if they are on first line treatment, it's different. But if they are on second, third or fourth line treatment, like many breast cancer patients would have 6 or 7 lines of treatment, then I think they should be referred a lot earlier on. But it is also very dependent on individual oncologist behavior and individual oncologist preferences. Some oncologists like to care for their patients themselves, including palliative care, and also it depends on the availability of services in the area. I do an outreach clinic in Bundaberg. There is no palliative care service. There is a GP who is trained in palliative care who helps, and she comes to our multidisciplinary team meetings. But there isn't a clinic that I can refer patients to like we have at the Mater. But I strongly believe palliative care should be well integrated into every patient's care with advanced cancer, not just advanced breast cancer, and it should be part of their care. I mean, these clinics we started at the Mater Cancer Center were small clinics, and the role has just expanded. And it's good that we have it for public patients and we have it for private patients there, that patients come in, they come in for chemotherapy, see the nurses, see the oncologist, and they also see the palliative care in the same visit, which is kind of what it should be like. It's a change, it's a cultural change. It is going to take time, it won't happen immediately.